What did you say?
You could open the meeting first, then read it.
Well, the meeting is open now as of 4:35 p.m. Is that okay, Paul?
All right, persuade to Governor Baker's March 12, 2020 orders suspending certain provisions of the open meeting law, General Law 30A, Section 18 of the Governor's March 23rd, 2020 order, imposing strict limitations on the number of people that may gather in one place. This meeting of the West Newbury Board of Health will be conducted by remote participation of the greatest extent possible.
Good enough. At least we're open. And we'll just wait a couple minutes, I guess.
Bob said it's not working, so I told him just to call in.
Okay. Tell us when I don't know that I can see when he calls in, Paul. I don't know if it shows the signal on my.
You'll see.
Okay, I didn't know.
It may be worth it for us to all get together and meet together, even if we all get COVID, just so the meetings go better.
Sign me up. Excuse me. Sorry about that.
So, Paul, how did you like that inventory? Little mismatched lot numbers and a little bit of this and a little bit of that?
It's all good.
I know.
So Tina and I are going to talk about utilizing some more of those random lot numbers to get rid of them.
Yeah, that'll be good.
We'll give Lauren a number.
Mm-hmm. Yeah, that'll be good. It's funny because it's like we were cherry picking all the different lot numbers to make it work for us. But I knew eventually it was going to get to the point where we'd be piecing it all together.
Yeah.
Paul, have you been over to the school over there in Newburyport?
Yeah, a couple times.
Are you going to set up on Friday?
We're setting up Friday at 3 o'clock, so we'll stay there until you guys show up. But someone from pharmacy, I encourage you to come just to make sure they know what to get involved with and know what door to go into in the morning and all that.
Yep, I think that'll be good because I'll be there early in the morning. And did Lauren already mention to you that we're going to need the place open at 6:30?
No, but we can let the custodian know. If have to, we can get the fire chief to let us in, or fire department. They got the master key to everything. So if we need to get in there, then we can get in. But that's why someone from pharmacy, either you or Lauren, make sure you can come on Friday afternoon.
Yeah, I think I'm planning on going. I'm pretty sure Lauren's going to go too, just so she can scope it out too.
Yeah, it's going to be a little different setup. You're going to be each going to have your own individual desk with a plexiglass sneeze guard between you and the person in front of you.
Really? In the art room?
Yeah.
Oh, that sounds nice.
Bob, is that you? Caller number 1. I think that's you, Bob. If it is, you're going to unmute yourself.
How do you do that on the phone?
Is that you, Bob?
That's me.
All right, we got you. So Blake opened the meeting. Tom read the fancy paragraph. So I guess all the hard work's done for you.
All right. I don't have an agenda in front of me, Paul, so I don't know where we are.
All right, Paul, why don't you go with the steel landfill update, sir?
So on the steel landfill, Bob signed a couple of new proposals this week. One was for the biannual monitoring of the groundwater, and the other one was the monthly monitoring of the gas vent. So we're still going good on the landfill maintenance.
So how much longer are we going to have to do monthly monitoring of this? When are they going to break it up into every 3 months?
We put the trench in last September, so I was thinking we probably got to get through at least another at least another full cycle of the weather, and then we can petition to the state to maybe do it. We could try it quarterly, see what they say. But if they back off to every other month, but a couple of times we did by accident skip a month because of COVID or the weather or just the way it worked out.
Uh-huh.
But yeah, we could try to petition. I would say, I wouldn't try to petition until, at least we get a good year behind us, because that's what they told me before was, we can try. But I think definitely for next budget cycle, we can try to reduce it maybe August, September, October. That way, when we do FY22, of that budget, we can hopefully have reduced the number.
So what does it cost a month? What is it per month?
$15.50 to monitor the gas vents a month.
Yeah.
And it's about $6,300 twice a year to do the water monitoring of the water wells.
Okay, so about $1,500 a month. Okay. All right, that'll be good. That'll count up a little bit if we can break it up. All right, thanks.
Do we want to go on to Diane's contract or PHN?
I would suggest that. I know that Diane and Tom had spoke about this, and then I can let Diane or Tom start, or Tom, and then I talked to Angus today a little bit about it. So we do have a plan. If the board, whatever direction the board goes with, I do have a plan that I spoke to Angus about. So I think overall we'll be in good shape.
So
Okay, somebody's going to have to bring me up to speed on what this is all about.
I think Tom is going to, I think.
I think I'm going to attempt to, and then Paul, you can fill in any of the additional information. Going forward with our budget for next year, not knowing how much COVID is going to influence the work of Diane, and also where the money would come from to cover her costs, if there's no deferment of costs to the state of the federal level for COVID. So we don't know those two factors. We don't know how much it's going to influence her, and we also don't know where the money's going to come from. So I think the prudent thing for us to do is to try to allocate some money for this fiscal year coming up, so that we have the money if we need the money. Is that correct? Is that a correct assumption, Paul?
Yes, because right now all the COVID extra from the public health nurse has been paid through the grant we have, CARES funding, but most of it's through the Merrimack
CARES
Metropolitan Commission. So moving forward, that money I think is going to run out in June 30th. If COVID continues, which it looks like we all know it's not going to end for a while, it's going to transform into some kind of seasonal thing like the flu, or just be persistent throughout the year. But yes, we need to have some kind of funding source moving forward July 1st and beyond to pay for any COVID expenses.
It's my understanding that the budget's already set, and the selectmen have already approved the budget. It's just gone through. So adding to it at this point, I think, would be almost impossible.
No, I talked to Angus today, so I think if Diane and Tom can finish up what the potential thought was, then I talked to Angus about how do we do what we need to do, and he was fine with all that. So, yes, the budget is kind of closed for the selectmen, but we can definitely get around that if need be. I don't know if we need to, but we can.
I'm going to be honest with you. Before I vote one way or another part, I'm going to want more information on that. I'm sorry, because the budget's already closed.
Well, Bob, if we don't acknowledge this at this point, then how do you add stuff onto a budget later if you need to? Like, what's the mechanism for doing that if something comes up?
Two that I'm aware of: reserve fund transfer, and I go to Paul's town meeting with an item to increase the payroll.
Okay. So if we ended up stopping getting the extra funding from the federal government, and that happened in July, would it be possible that we could cover additional expenses until we're able to get that? Would that be, we're still going to be able to pay if we need to pay Diane going forward?
I like you said, I would like to talk to the town accountant and our town clerk or Angus before I vote one way or another.
Okay. All right.
It's not that I don't want to see something done, but usually at this point in time, it's too late to add anything to the existing budget.
Okay.
Because like I said, the selectmen approved the budget already, so. And I think it's already gone to the printers.
So right now, there's technically no contract for the public health nurse beyond June 30th. So right now, there's no contract. There is money that the FinCom and the selectmen approved for the town meeting of X amount of dollars. And when I talked to Angus about that, which we're in actually good shape, because what Angus did was in the line item for public health nurse, he actually combined the two line items we had last year. There was a line item for public health nurse COVID, and there was another line item for public health nurse, regular disease surveillance. And he actually combined them both for a total line item 8175. So currently right now we have 8175 in the line item for the public health nurse next year. It's better than I thought, because I was unaware that he had combined them both. So right now we have more money in the line item budget than is in her current contract at the $400 per month. So I think at some point, I know Diane and Tom had talked about what potential increases per hours or what would, possibly be needed. But when I talked to Angus about it, my suggestion, and he said we could do, that was fine too, is that if we needed anything beyond what's allotted, then at town meeting, we could put a hold on the line item and then, revote that. And then what I suggested was that $100,000 article that we're going for a special town meeting, whatever, if we increase the line item for the public health nurse of X amount of dollars, we can deduct that from the $100,000 special article request. And he said we could do that. He said this is two different money sources, but we could do that, and that would keep the overall budget the same. That town meeting would vote on the same budget overall, but it would just be different funding sources. So he was fine with that. He just said whatever we want to do is fine. If we wanted to put a hold on the line item, if we needed to at that point, which we don't have to make the decision tonight, I would say we need to best to make a decision before town meeting. So we could put a hold on it. He would let him know. He would let FinCom know why we're putting a hold on it, and have it all ironed out before town meeting, so FinCon, Selectman, and himself and the Board of Health would know why we're putting a hold on it. And even you can even let Casey aware that we're going to put a hold on it for whatever reason, and then so he was fine with that. So we don't need to make a decision tonight; it just needs to be discussed.
All right, like I said, I would rather hold off and for my own personal information, figure out what's going on, how it's going to work, and all this other kind of stuff before I vote. That's all.
I think that's fair enough. I just think we just need the board just needs to discuss, what I don't know if Tom wants to elaborate what he thought the conversation was with Diane, or Diane can speak as to what increase potentially would be or would need be moving forward. So, because right now, as Tom said, any COVID money we're getting from the state and feds, they keep on extending it, but they're only going to extend it so far out. And as of right now, I think it ends June 30th. So I don't think, like I said, you guys don't have to make a decision tonight, but I think you definitely need to discuss and come up, throw some numbers around just so people can digest what we're talking about and then move forward.
Yeah, well, this is really the first I've heard of this, so I want some time to talk to Angus about it before we do it.
So Bob, would you prefer not to discuss just the concept of, it looks like we're gonna need to allot more hours for her, even beyond the, how much it's gonna cost or where we're gonna get the money from? Do you think it's appropriate just to have a discussion of Diane's role right now, and then Diane's role as far as when we need to budget Diane for next year and what her responsibilities look like they're going to change to, and how that could influence us as far as we may need to try to get more money for her. However we do that, whatever the mechanism is, do you want to discuss that? Just an overview of the discussion that I had.
I think you probably need to overview what's going on, because like you said, this is the first I've heard about it. And like I said, I'm not going to go for it until I talk to Angus to see where the finance is coming from. But because like I said, the budget's closed. So, but we can certainly discuss, the reason for doing this.
Yeah. Well, I think that I'm kind of a little naive and a little ignorant to how this whole thing works with budget. So I apologize, because when this was brought up, I was like, why didn't we think about this? Because we knew that our potential gravy train at the federal level was going to stop, and then how are we going to handle this as far as how we impact? So because I know that because like I said, we don't know how much COVID is going to influence Diane's job going forward as we vaccinate more people, but we still have the potential that she's going to be still doing tracing for us, and she's still going to be tracking people down, and she's still going to be a resource for us and doing all the stuff that she's doing right now that's already getting paid for. So what my question was to Diane, knowing that this could go on, this most certainly can impact our next fiscal year as far as COVID goes, and if we don't have money, how are we going to budget for that, potentially budget for it? So what I wanted to get from Diane is, what do you think of the gaps right now as far as how you're doing your job now, and how that's not on our budget, is directly reflective of what she's doing, because we're working out of this COVID money, and so I tried to get a sense from Diane how much time she is spending per week, in addition to the regular hours that she's spending, and she said it's about the tracing that goes into COVID, about 2 to 6 cases per week. And that's not necessarily positives in our community. It's positives outside of our community that are affecting our community because they're direct contacts. And that's where Diane's workload comes in. So we just have to remember that it's not just the positives in our town, although we do have positives in our town. It's the fact that her impact is where it could happen anywhere, and she's notified that we have a close contact in town, and then has to follow up on all the peripheral contacts. So anyways, she said, I asked her how much it was, and she said it's, it can be anywhere from 2 to 6 cases per week. And she says that the current tracing requires about 4 hours per week, is what she's actually working to trace these and to follow up on. And so I think the tracing, is part of it is the initial phone calls, follow-up phone calls, contact, intake, interviewing, and then follow-up. I think that's primarily it, Diane. Is that right?
Yeah, that's correct.
Okay. So what Diane is thinking is that based on the current trends right now that we've been dealing with, over the last 6 months, which, has an average that is probably higher than 2 to 6 cases per week. But with the trend going down now and people are getting vaccinated, we're not expecting it to be as high, but 2 to 6 cases would probably be a reasonable amount based on her experience. Is that correct, Diane?
So I would think so. 2 to 6, as opposed to cases, it would be like events. So
Okay. So basically what that means is that with the 2 hours that are allotted right now with her current contract, that would be an additional 2 hours that you may need per week. Is that right, Diane?
Correct.
Okay, all right. So the other thing that came up was the because due to the nature of COVID and the continuous changes and updates of guidelines from multiple regulatory organizations, additional time for infectious disease nurses, like in-services educational programs, are necessary for her to be current on what the current practice is right now, so that she's giving us the right information, she's giving our community the right information. And that's just voluminous amounts of information that she's getting from different resources. That can be the CDC, the FDA, the Department of Public Health. I don't know if there's other ones that you have to follow in addition to that, Diane.
Yeah, there's the Adult Immunization Organization, it's the MIIS. And the school system has their own departments. Try not to confuse other issues, but just when it comes to West Newbury, it would be mostly DPH. It would be ISIS, which is the kind of the company that oversees Maven, and they put out a ton of educational information. The epidemiologists do, right now, they're still doing bi-weekly meetings with all of the Maven users. They're doing, I think, Paul, you're down to 1 week with the local Board of Health meetings, 2 a week still, 2 a week. And those are an hour a piece. And that's just keeping up to speed with just COVID.
So with that, I think the board needs to appreciate that if we want her to be current and we want her to be as as important and as effective as she is right now, then we need to give her some time to be current. And that's probably reasonable to be about an hour a week of time that you need to spend reading and updating and participating in seminars and phone calls and Google meetings and all that kind of stuff. Is that appropriate?
I think it will be. I think we should be seeing a decrease sometime soon.
Mm-hmm. Yeah.
So I think an hour, so we're not just talking about COVID, we're talking about incorporating COVID into the entire infectious disease process. So I'd like to stop separating them at some point soon and just incorporating it back into the normal job. And so it's going to be education of continued COVID guidance plus guidance on ongoing immunizations for the flu, what's going on with mosquitoes, and there's just continual education every season depending on the season and what's out there.
So previous to this, your allotment of 8 hours per month and 2 hours per week, because the monitoring and the Maven work that you were doing at that point, was there time then that you could do the education then? But now are we basically sucking up those 2 hours into this 4-hour need that we have right now, and there's not that available? Is that kind of what's going on now?
Right. So I was not able to spend. So if you any educational anything would definitely account for at least an hour of time. So there wasn't really any kind of education seeking. COVID's really opened that up and said, look, there's all these resources, there's all this information out there, and if you're really doing your job well, you really should be kept up to speed on all of these different things. And I think the state's using this COVID platform where everybody's paying attention right now, at the very least twice a week. They're saying they're starting to integrate the other DPH issues into their COVID programs.
Does anybody have any questions for me and Diane on this?
No, I think, she's doing a great job, and we need to be, up to speed on everything. It's just, like you said, this is the first I've heard of it. And I just want to make sure we get enough money somewhere. I just wanted to talk to Angus the powers that be and see how we're going to do this. That's all.
The only question I had to anyone, mostly Diane mostly Diane, quite frankly. Diane, at the end of the day or at the end of the week, I know we're not going to vote on it right now. What do you think is adequate? I mean, I'm adding up things, 4 hours per week for the 2 to 6 cases. You have an hour a week. I mean, are you talking probably an additional anywhere from 5 to 10? I mean, just give me
No. I think that we're talking about a total of 5 a week. 5, not additional, just 5. So an additional 3 hours a week. So a total of 5 hours a week.
Okay. All right. No, I was just trying to get a general sense right now. You know what I mean now?
I'm trying to be hopeful here.
No. I know, I don't know about anyone else, and I'm sure they are. I'd rather hear that than not, you know what I mean? And then let's go down the road in 6 months and have to go to another special town meeting and ask for more. And you're never going to know, because we can have an outburst tomorrow and it could all go downhill. None of us are going to know that. It's all a hypothetical guess, in my opinion, but you're trying to go on what your trend is I would take it.
Right. So we're talking about what we are hoping the base is going to look like. That obviously does not include running a clinic or anything like that.
No.
Any major events. There's always been a carve out in the contract for such events, so that's not a concern.
Okay. No, that was the only thing I had to comment. Seriously, no, beyond that, not comment, just ask.
So Bob, just to get back on your point, yes, this is all new. It's all new to everyone. It was really Diane and I discussed this, I think Thursday, that it just kind of light went on in our heads that, wait a second here, we're running out of COVID funding here at the end of the year. We need to address it. So it is all new. This is the first time and we are discussing as a group. So you didn't really miss nothing. This is why I asked for it last week to be out of the agenda. So,
Right.
yeah, so this is why.
No, I just want to make sure that, if we need it, now we understand exactly where the funding's coming from, because any increase in the budget is, somebody's going to put a hold on it at the town meeting. And I'm probably the one that's going to have to be standing up there to justify it. If I don't know what I'm talking about, they're not going to pass it. So I just need to, feel comfortable with it. So.
Yep. No, it's fair enough. The only reason why I mentioned to Angus was today, because he called me in his office to talk about some other things, and while I was there, that's when I mentioned it to him. He asked what was on tonight's agenda. That's what kind of got me to talk about it with him. But I was not in the impression that we had the 8175 in the budget already. So if the board decided to say give 5 hours a week, that's $1,000 a month, that's $12,000 a year. We already have 8175 in the budget, so that'll be additional 3825 asking, which is better than another, $6-7 grand ask. I was unaware that he had the 8175 combined, so that would actually not benefit. He did that.
Right, that's not a problem. I just would like to, like I said, I just want to get it clear in my head.
Yep.
And figure out where we're going. That's all. I don't. I'm not saying that we shouldn't do anything. I just want to know what the heck I'm talking about when we get the time in for. That's all.
No, it's all fair enough. Just figured, let you know that this wasn't planned a month ago. Just the light went on our head saying, wait a second here, COVID may be ending, funding's going to end for COVID, and COVID's not ending, but the fund is ending. So we just had to come up with a plan. And then the wrestling came up. That's why I asked to have a meeting this week to discuss, these 3 things on the agenda. So.
Okay. All right. Let me do some talking tomorrow to Angus, and I'll sit down and talk to you a little bit, and see where we go from there.
All right. Perfect.
Thanks, Bob.
Hey, not a problem. Not that I'm trying to deny anybody anything. I just want to make it clear in my head. That's all.
Perfect. All right. Other than, are we on with that?
Yeah, I guess if we can go on, I think we're down to that public health nurse contract item, but I think if we can go to the close contact item.
I think that's a good idea.
Yeah, I think that's a good idea.
Give Dr. Bode in time to, so the reason why I wanted a close contact, because last week or a couple weeks ago, well, last week the school went back in full in person. In the DESE guidance that I sent you guys last week clarifies that in the classroom or on the bus, the close contact definition is within 3 feet. But throughout the rest of the entire country, any other thing you do, close contact definition is within 6 feet. So now we get double standards for whether you're in the classroom or on the bus compared to in line at lunch or at a friend's house or your parents' co-workers in the office setting. So we just need to discuss this because the school district needs to know which way they're going to go, whether we have a separate definition for close contacts in the school setting according to DESE, or we stay with the definition of a close contact that the CDC and pretty much everything else is going by. And where problem lies is that if you're close contact anywhere besides in the classroom or the bus, you need to be greater than 6 feet or you need a quarantine. So at one point, if you're on one avenue, you may need a quarantine, but if you're in a different location, then you don't need a quarantine. And then these nurses, whether it's Diane or the school nurses, need to tell these parents when they do the contact tracing, who's a close contact and who isn't. And you kind of could potentially give mixed messages. One day you're calling a parent and saying, child's not a close contact because he was 5 feet away from someone. But you're a close contact because your employer at work ratted you out and that you're a close contact at someone at work and the parents got a quarantine, but the child doesn't need a quarantine. So it's kind of a mixed message. So I'll let Diane or Tom speak on that, but that's my take of what we have to decide on.
So Diane, do you want to explain what the current practice is right now at the high school and the middle school?
Yeah, absolutely. So we've definitely held strong at Pentucket with a 6 foot, 15-minute rule. For sure. We have opted for a 10-day quarantine with a test and no symptoms. They can return on day 11. With athletics, if they're in athletics, we're having them stay out for the full 14-day quarantine. And that was in light of us knowingly putting them into a close contact situation during a known quarantine period. But at that time, the schools were also all 6 feet apart. We made that ruling. Now we are having them anywhere from 3 to 6 feet apart. We're fortunate that our system has worked really hard to put the students at the most distance they can. They didn't change 6 feet to 3 feet and say that's the new norm. The Page School, I believe, is 98% 6 feet, if not 100% at 6 feet, even with 100% in person. So that statistic changes with each of the schools. But now we're in a place where DESE has mandated in-person return to school 100%. We're also in a place where in our community of West Newbury, we are most likely going to be or have achieved herd immunity. So we have protected our community. So when we talk about what our goals are, and our goals with COVID have always been to protect our most vulnerable population, right? So we have successfully done that through vaccination. So we're not as super concerned about our children being in these close contact situations. The problem is that the rules, the science have not changed. So you can still contract COVID if you're within 6 feet of somebody for 15 minutes or more. That's not COVID specific. That's a droplet precaution. That is any virus that is spread through this droplet process. Those are the parameters. and the science is not ever going to change. But that doesn't mean our response isn't ever going to change. The problem is that the departments that oversee the boards of health, or that guide the boards of health, the Department of Public Health and the CDC, are not in total agreement with the 3 to 6 feet. Although I did hear this morning that the Department of Public Health, I believe, is supporting DESE in their kind of quest for this 3 to 6 feet and no quarantining. So I think there might be a push this week for the Department of Public Health to ask us to potentially consider complying with the DESE guidelines. But I think we're right in the middle of that. So there's more to come, and it just came out this morning. And unfortunately, Tom and I had a conversation about it last night. So they're ever changing on the state side. I don't think that the epidemiologists are happy about it, but I think given that we are protecting our vulnerable population, what is the consequence on the community if these children actually have spread in school? What is the potential consequence? You know, I mean, eventually we're going to have to live with this virus like we do the flu. People are going to get sick. People are going to be out of school, out of work. We're not there yet with the guidance that we're being given by the state. So we do have an option of looking at what we want to do. So right now, even given DESE's request for no quarantining between 3 and 6 feet, the Pentucket Regional School District has opted for now to continue with a 10-day quarantine on anybody that is within 6 feet of each other, right? So potentially that equates to, especially when you get into the middle school and the high school, if you have one student that's positive, they have 7 separate classes with potentially 4 close contacts within 6 feet of them at any given time. That's 28 close contacts that will be sent home for 10 days. And the recommendation would be for them to get a test. We have not had any spread in the school, so I think that it's going to deem some more discussion over the next couple of weeks. So basically, DESE is suggesting that within the classroom, and only within the classroom and within the bus, so your classroom periods last approximately 45 minutes each, that if you're within 3 to 6 feet of a positive, you do not have to quarantine. The school does have to notify the family that they have been exposed to a positive case, and that under normal circumstances, they would be considered a close contact. They are recommending that these children get a test on or after day 5. We currently have a rule that if you are pending a test, you can't go to school. That is not enforced here either. It's, you're not quarantined, but you should probably get a test on day 5 is what DESE is saying. So it, again, only applies in the classroom or on the bus. If you're in the hallway, the bathroom, lunch, recess, waiting in line for the bus, sports, any extracurricular activities, the normal DPH quarantining rules would apply. And that causes a great deal of confusion. I'm not sure how that's going to play out with the parents, but
I don't understand. I mean, sorry to butt in, Diane.
yeah, no, I can talk forever.
With not you making it confusing, with them making it confusion, what is the downside of us just keeping it to 6 feet the way it is? I mean, am I missing something? I'm not sure that I feel as if there is no downside to keeping it to 6 feet. Why drop it to 3 at this current moment? I mean, eventually we may have to. We're all, like you said, we're all vaccinated and herded, but until then,
Yeah,
is there a benefit? I mean,
I agree. I think
Okay,
that
good.
there's nothing wrong with keeping the 6-foot rule. It's what the science talks about.
Yep.
I think one of the things that we might bring up, excuse me, tomorrow in our meeting with the other boards of health and the superintendent is maybe considering the 7-day quarantine instead of the 10. And eliminating the sports 14-day quarantine because we're forcing them into a school situation anyway. The
Right.
sports are all now outside. It's going to make a significant difference. So that might be the piece that we want to discuss to change, is to kind of make it a little easier.
Right. I would not that right at this moment our vote is counted at the board. I mean, at the, tomorrow's meeting, but I think that makes a lot more sense than trying to reduce it to 3 feet. I mean, those changes seem a little bit, well, like you said, most of the athletics are going to be held outside now. Not all of them, but a lot of them are going to be. So all that makes sense to me, but changing it to 3 feet doesn't seem like we gain anything. There's nothing to gain off of it right now. And so be it. If the state changes next week, there's no reason we can't be a little bit higher standard. I mean, that's my opinion.
Absolutely.
Tom or Bob?
No, I agree with you.
Oh, Tom, you're muted.
I think Paul did that. I think that when you read about this and you go, why would they want to do 3 feet only in certain situations, and you wonder whether or not if it's somewhat not self-serving, but it's to promote the ability for kids to be in classrooms, when there's limited space, but not to include all the other parts of the school experience when they're together. Just seems odd, and it almost seems like, do they really have the science behind it to say that this is okay?
Yeah.
And what is it that changes the environment from a hallway to a classroom that makes it different? Is it cleaner, or everybody's still wearing masks? I mean,
Right.
what's the difference? And that's the part that I don't quite understand. But I think that we have to, as a board, we have to be available. We have to appreciate what the science is, and if the science changes and says that we can go to something that's 3 feet, then I think that's important to do. But there's so many variables working here that it makes it more difficult for us. And one of the things is we're vaccinating students now. And when we talk about this, when we talk about the quarantine, whether it's 10 days or 14 days for an athlete, or we go down to 7 days or whatever. If you're fully vaccinated and you can prove you're fully vaccinated as a student, you don't have to. That's not an issue anymore. And so, so there's a lot of the incentives to try to dissuade people that have insecurities about taking the vaccine and getting the vaccine and having their kids vaccinated. There's some motivation there as far as how their lives may get a little bit simpler as far as their school lives go. But I think that I think the double standard is an important thing. I think when you like what Diane said about our responsibility to everybody in West Newbury, not just the students in the schools, I think that's important to think about too. But then you have to look at our little environment that we have, and our environment that we're talking about is West Newbury, and there's 73% of the people that are older, 75 or older, that have been vaccinated, and so that's good. So we're protecting them. But the other thing that we have to think about is that we're responsible for an environment within our town that's affecting 2 other towns too. It's not and so that's something that has to be considered also in this. So I mean, I think the 6 at this point, I would lean more towards, the 6 feet, but we have to be open and willing to change as the information changes, and as the variables change within this to make it, easier. I mean, the kids have a couple of months worth of school left, I think.
Oh yeah, best, yeah.
It's not a lot more.
No.
And it is getting warmer out, and windows are open, and the airflow is better, and so we have that all working in our favor too. But I can't appreciate the change, even though Diane said there may be some movement going on that may help us to get a little bit more support as a Board of Health in adopting and endorsing and saying it's okay to have the 3 feet rule. So that's kind of my feeling on it right now after my extensive conversation with Diane last night.
I'm very receptive to, changing, you know what I mean? If it comes up proven and stuff like Diane and you were saying, absolutely, I'm open to it, especially where, the DPH and, all the state guidelines. Let's face it, we're in the same boat as, they put us all in the same boat as like Boston that may be overpopulated, where we can maintain the 6 feet and they can't. So I think that's a strive on their part to make sure all the kids are back to school. So, we are luckier is my whole point. So when they decide to say 3 feet and it's good for people that with a crowded facility, we definitely should be all set. I would like to believe. How's that? That's my opinion.
Yeah.
Do we need to vote on that, Paul? Or does Bob have anything?
No, I'm fine.
Is that something we need to vote on, Paul? Or was that for discussion? Can't hear you, Paul.
I think you guys can vote on it unless Diane thinks we can, should hold off, or she thinks that we need to vote on it tonight. Because I know we get a meeting tomorrow with the superintendent, and I think the other 2 towns are going to really, rely on what West Newbury Board of Health says. I know the school committee's meeting tonight, and they're also going to discuss it. So I think the school committee can also overrule us.
Of course they can.
They may say, no, we want 6 feet anyway. But if we say maintain 6 feet, keep the definition, the same for all, I think obviously they're going to go with that. So I think if you guys feel strongly about maintaining the same definition, close contact of, 6 feet, I would recommend you guys vote on it and we can just move on.
Diane, how soon do you think we're going to be hearing more information on this discussion?
I think it's going to be over the next week or so.
Okay.
The next couple weeks, because they're getting a lot of pressure to come up with what they mean by it. So although they said that they were aligning with DESE, there were a lot of questions on how it should be handled, and they could not answer those. So, so I think it's going to be the bone of contention for the next week or two. So I'm not sure. I'm not sure that a vote tonight wouldn't prompt, wouldn't need to be changed within a week or two.
So there's a potential that we're going to have more information that's going to make it a more informed decision.
And
Yeah, it sounds that way.
and the way I left it with Justin the other day was that my recommendation for the West Newbury Board of Health was we're going to maintain the definition of 6 foot across the board until my board had a chance to discuss and vote. So if you guys don't vote tonight on it, then it's still going to be 6 feet until you guys discuss and vote.
Then why don't we leave it alone? You can tell the superintendent that we all agree that we want to keep it 6 feet until we hear other information. Would that be good enough, Paul? Saying your board backs you 100%?
Yeah, or you can just vote on it. Just that we keep it 6 feet. So the way, might as well just vote on it. That way you guys have it.
Okay, I say we take a vote to vote on keeping 6 feet apart as the current state rules are in our school system, Paul. I mean, we can't say middle school, can we?
Well, no, you got to reframe that. So it's not 6 feet apart. It's 6 foot definition of close contact.
Right, definition. You're right. Again, Tom, I'll let you do it.
All right. So I make a motion that we continue the definition within the West Newbury High School and middle school and state school. In school, close contact is defined as 6 feet and not 3 feet at this point.
I second that. All those in favor?
Aye.
Aye.
Aye. Motion passed. All right.
So Dr. Bowden has joined us just in time, because I think that the last thing on the agenda is the discussion on the wrestling.
Yes.
And I submitted, the board, the documents from the MIAA that was, given to me by either Dr. Bowden or Dan Thornton, the athletic director. I know you guys had a chance to look at it. And then, I guess we can just open the discussion to whoever wants to start.
I did read the guideline for wrestling, and also the kind of the standard format that they've been using the fall and the spring sports as far as the general guidelines, and then the specific for wrestling, and I think that trying to work through this, I think that the guidelines were designed to kind of modify the sport somewhat, and also to try to mitigate the potential transmission of the virus. So I think that when I talked to Diane about it, we still have no history of any student athlete positive COVID cases that have originated from any of the school sports environments. And then we also have Diane available that if we did have a situation, we would be able to identify it quickly and to be able to act on it. And when I looked at the different, concerns that I had about it, I think the most obvious thing for us as a board is the fact that the kind of the nature of the sport is that it's close contact, and although that the close contact with the athletes is very limited to small practice cohorts, and also the matches are limited, so there's not like multiple contacts within the different matches that they have, or the meets that they have. Just the very nature of it is that they're so close together that that you have the possibility of mass displacement during it, and even there's information that says that the referees, if a wrestler's mask is removed or altered during competition, the official must stop the mask unless they're in a scoring situation, which I didn't quite understand that, but I think basically what they're saying there is that they're acknowledging that the mask can come off and can be displaced. And so that was kind of one of the concerning things I had about that. But knowing that that's the nature of the sport, and if there's other things in place to mitigate it, then maybe we're going to decrease the risk just by the smaller sample size, and for the most part, probably the masks are going to be in place. The other thing that I had a question about was that Dan actually answered was, will the weight room be utilized? I didn't know whether or not he had actually said anything about that in our emails. Paul, did he say anything about the weight rooms for training?
Yeah, I had told them last week that, the school could use the weight room as long as they follow the sector specific guidance for, fitness centers.
Okay. The other thing that seemed to be quite important in the sport is the proper cleaning of the wrestling mats. And the guidelines say that they must disinfect the mats prior to and following competitions. Now, I think that would also include any practices. That would include that too, I think. Dr. Bowden, would that be the case on that?
Yeah, so you're right. The optics are hard because if they're separated by any distance, you're not doing it right. So there is no 6 foot, 3 foot, 12 millimeters, but it's also brief, right? The match is 6 minutes. The process compared to normal is very different because in the past, I mean, we had a Pentucket holiday tournament where we'd be kind of close to the fire laws with the number of bodies that would be in there. And so this is not allowing tournament. There is no, it's just schools and limited in travel, limited in how far and who you're wrestling with. So it's really kind of pared down to minimal bodies present. And let's face it, nobody goes to watch a wrestling match except a couple of parents. The hygiene thing is kind of part and parcel of the sport too, because historically they need a pre-weigh-in sort of visual for skin infections, and the mat thing, they're washed before every practice historically, never mind now. So the only add-on is that if you is doing it an extra time, so if they had a competition, you're washing it down before you tuck it away, but when you roll it out the following day, they're washing it always anyway. So it's just more emphasis on it, but it's already part of the culture. That's just part of it. You roll it out, you wash it, you tape it down, and you get ready. So it's hard. I agree. This is hard if you don't know the sport and you don't know that, one, it's been happening across the country in January and in February in most of the states. Some of the New England states have pushed it to spring. I think it was Connecticut, Rhode Island, one of the others, but New Hampshire had it in the winter. Surprise. So that was a little dicey. So at the moment you have the additional benefit of almost having herd immunity in the group. There's only 11 kids, and the coaches are vaccinated. 3 of the kids are vaccinated, and 3 of the kids had it. So of the 15 people in the room, you already have 9 people that have either had the illness or been vaccinated. So it's sort of a low risk group just because of who they are. And what you read compared to what a normal winter would produce, it's nothing like it. And they all understand too that it's all dependent upon what goes on in the school. If someone's at a party like Newburyport football having to get shut down because something happened within the school, or that's just part of the process. So I guess they're looking for a chance to try, I guess, is the bottom line. And the other is, I for full disclosure, I'm one of the coaches. So I just want to say that out loud so that it doesn't not get said. And the kids have been wrestling all winter. It's not always above board. They go and they're elsewhere. They're better under our eyes than elsewhere. But I think you have hopefully give you a sense of, it's very different. It's very short. And I don't know how much science there is with an indoor basketball game, saying 32 minutes of that is much less exposure than 6 minutes of being really close together.
Yeah.
One of the other concerns that I had was whether or not we were going to be opening up the school to host any competitions, but it doesn't sound like we're going to be doing that.
Can't do it, right? There's just no way with the construction. So if we have anything, we got to go somewhere else.
Okay. So that was, most of the question the concerns that I had were, had to do with having outside entities in the school and populating the school and using the locker rooms and that. And that's not going to be an issue. So those are less of a concern. But does anybody else have any questions, Bob or Blake, for Dr. Boda?
No, I don't. I mean, I read the regulations, and everybody's had 14 months to get used to the regulations and what they require and all that kind of stuff. And I can see no reason right now to vote against doing wrestling or anything else.
Yeah.
I mean, all the protocols are in place.
Right. One of the other questions that I had was was who was going to be the schools must designate a coach or a site supervisor to be responsible for responding to the COVID concerns and supervising adherence to the established protocols. And I asked Dan that, and he said that the coach would do it. Coach Palio would do it. Would be the person along with Dan looking out to make sure that when the practices were happening, that the guidelines were being covered. In that Dr. Bowden would be a resource if needed for those kind of situations or questions. Yeah, so that was basically, those were the questions that I had, and those were the concerns that I had, and I kind of wrote out the way I kind of felt about it. Are there any other questions about it?
I won't really necessarily have any questions. I'm certainly no doctor. I'm not in the medical field. I only read what I only hear what I read or whatever, how else that just come out, what I read from doctors all about this COVID. And I mean, I try to base it on facts. And the thing is that it really, after 13 months, the two main things that we're supposed to do is social distancing and with masks. For me, there's always going to be one out of the bunch, and that would be me. This is way too much close contact for me. Mask possibly falling off. I mean, I read it too. If they're ear muffs, I'm not sure what they actually call it. I apologize if I'm not, up to date on their stuff. If the ear muffs fall off, they stop the match, and if a mask falls off, they stop the match. I think science has told us that the more we can keep. I mean, we just had a discussion before this about keeping kids in school 6 feet apart. But here we are. Here we're going to have a discussion about having kids direct contact in their faces. What I've learned over the last 13 months is stay away and keep masks. So it doesn't make sense to me, and I got to vote with my heart and my common sense on that. But that's just my opinion, and I do vote on. I try to use my common sense, and maybe at this point it doesn't make much sense to some people, but it makes a lot of sense to me. That's all we've learned in the last 13 months is to keep social distance. And this is not a social distance sport. So that's it. That's just all of my comment.
I think the same. I was thinking the same way as you, Paul. I mean, Blake, as far as the concerns go. But I think that when you think about, the sample size, which is a small sample size of students that are being part of this, that are competing, and as much of it as it may be, the absolute opposite of what we're trying to do as far as keeping people apart. I think that it's a very controlled environment. And the other things that you think about is that if we're talking about 10 or 11 or whatever it is, athletes that are doing this, and they're training together, they're all together at the same time. They have responsibilities of self-monitoring that they have to do. That they have to report on and make sure they're all right. They have to do self-monitoring every day, just like going to school. And so there's a vested interest for, the coaches and the volunteers that are involved with this to make this run okay, all right? And this isn't a basketball team. These aren't 30 kids getting together and having these big giant meets and putting themselves in a situation where they very much could, a bigger sample size is more likely to have more issues than a smaller one. And then also the fact that we have, like Dr. Bowden said, we would expect that there's a majority of either passive or acquired immunity to this virus within the students that are participating and the coaches. And so that's the only part that makes me think that in this small little cohort, it's going to be okay, even though it's directly in conflict to what we're trying to do, Paul. I mean, Blake, and I appreciate that.
Any more discussion from anyone? Diane, Paul, Jane? You're sitting there, Jane.
No, I'm fine with it.
Yeah, I would agree with all sides. I agree with what Blake's saying, but I do agree with Tom and Dr. Bowden that we do get some level of herd immunity. We do have a small, size that we're dealing with, sample size. So I think that you both are right.
Yep.
We have learned a lot about this over the last 13 months. These kids and the parents that allow on the sport, they should have enough knowledge and they have enough information over 13 months to make their own decision. So I would say that every comment that was made tonight is accurate.
Yep.
So I guess
I agree.
The optics are hard to ignore. You want me to step away, or?
No. Oh, gosh, no. Gosh, no.
All right.
I don't think. Does anyone else want? I don't.
Sorry. Could I make a motion then?
Sure.
All right, I'd like to make a motion to permit the use of the Pawtucket Regional School District High School Gym for the 2021 MIAA wrestling season for practice, and I said for meets, but if that doesn't need to be there, then we can take that out. Basically what we'd be doing is practice.
Right, if there is competition, it is not in the school.
Okay, so
If you wrestle Triton, we're actually talking about trying to do it outside, but it would not occur at the school.
Okay, so it wouldn't be on the premises, or it wouldn't be in the gym?
On the premises, because there's no place outside. We had a nice football field 2 years earlier. We pull them out there, but we don't. So
Okay,
if there is a meet occurs, it will not be in West Newbury.
okay.
That'll be elsewhere.
Then it would be just for practice.
Practice. Right, practice.
So approval with the following requirements, must follow all of the 2021 MIA guidelines specific for wrestling. Pawtucket Regional High School must designate a coach, site supervisor to be responsible for responding to COVID-19 concerns and supervising adherence to established COVID protocols. Requirement for the proper cleaning based on the Pawtucket Regional School District facilities approved cleaning protocols. Requirement for the proper cleaning based on the MIAA wrestling protocols. And a requirement that that all participants, which is players and coaches, and any volunteers, are required to wear facial coverings. There'd be no exceptions. The Board of Health will monitor compliance with these, the MIA guidelines. The Board of Health will monitor from Pawtucket Regional School District positive COVID cases and any case tracing that links to the wrestling program. And then the Board of Health can withdraw its approval for the use of the school or the paid school gym if it's felt to be causing a public health risk. And that's it.
I'll second.
Well, I second that.
Yeah, I did. I seconded it.
Do you want to vote?
Any discussion?
Any further discussion on that?
Cool.
All right, at this point, why don't we have a roll call vote? Bob James, aye.
Tom Fahey, aye.
Is Blake around?
There
Yep,
he goes.
I've been muted. Blake Seal, no.
Okay. Motion passes 2-1. Okay, anything else we need to discuss?
Thank you, Dr. Bowden.
Nope, thank you. I will exit. Thank you for your time.
Thank you for your time too, sir. Thank you.
You're welcome. Bye-bye.
Bye-bye.
The only other things on the agenda, Bob, was the septic plans, which you came in the other day and checked out. 4 of them were extensions, and 2 of them were new approvals. One was 2 of them were actually both new construction. So 2 new construction lots, and then 4 new construction extensions.
Yeah, and I signed them all.
Do I have to sign the extensions?
You could, I mean, yes, if you could, that'd be great.
You want to just leave them in your truck tomorrow morning, Paul, or tonight?
Oh, yeah, I'll put them in the, Jane, they're in the office still, correct?
Yeah, they're on the little table. They're already been stamped and all set to rip.
All right, so I'll put all the plans in my truck tonight. And then I'll put my payroll in there because I'm taking Wednesday and Thursday. I'll be back Thursday afternoon. So I'll put my payroll in there because it needs to be signed. It can be signed now because it's the rest of the week's vacation. So I'll put that in along with the plans.
Is Scott's payroll still in the truck, Paul? Did you see?
What's that?
Okay, so that could be signed too.
The
Anything that's in there, we'll sign.
so Jane,
Except the withdrawal slip.
Yeah.
Jane, the extensions for those septic plans. When I went into your office, there was the septic plan that had to be signed, the 3 copies of the plan, and there were a whole bunch of other stuff next to it to the left of it. Is that where the extensions are? And do I just sign next to Paul's name where it's yellowed out? Is that where I sign on those?
On the application, it should be all set. It's just the plan itself. There's a stamp that says extension on it, and it looks just like the approved one. And there's a space for your name, down below.
Is it just one plan for each of the extensions that I have to sign?
All of them.
Oh,
So there's
4.
probably 3. Oh, is
3
there 4,
for each,
Bob?
and they'll all have a stamp on it for the extension.
Yeah.
Okay.
Tom, you might want to get there an hour early.
It's a lot.
I know, that's what I just said. I'll be there at 6.
All right.
So that's what it looks like, Tom. You got 2 stamps. One's approved and one's extension.
Oh, yeah.
Okay.
Extension
I see
right at the
that.
top center. Yeah, it's top center.
Well, Paul, I can't see you anymore.
Yeah.
You've already signed this one
I signed the extension.
on this
No.
one, but Bob didn't sign this plan.
Just leave them in the truck.
I'll be around.
Put them all in the truck. I mean, doesn't matter. We got 2 signatures, so it's all good.
Okay.
10-4. Thanks, guys, for the meeting. And Diane, thank you for showing up with your time. It's nice to see your face. We never see it anymore.
Oh, well, thank you. It's nice to be here.
It is, isn't it?
Yeah.
All right, until next time, hey, guys, you think, if no one has any problem, do you think we can extend this to the 4th week? So we'd get back on the 2nd and 4th, if each time is
Works
needed.
for me.
Yeah.
Good. You guys good with that? Second
Yeah, I
and
think
4th?
that'll work.
Good. So Jane, whenever the 4th Tuesday of this May is, you can pencil us
The
in.
24th. It's the 24th.
Okay, we'll pencil that in. That sound good?
That sounds great.
Paul said the 25th.
The 25th is already on the agenda.
Oh, I don't have it in front of me, Paul. Is it on the agenda?
Yeah, the 25th.
Okay, no, I don't have the agenda in front of me, I mean. All right, kids, have a good night.
Thank you.
Adios.
Dogs are let out.
Right.
Bye.
Right.